Have you been trying to get pregnant for a while but nothing's happening? You're not alone. For many couples, getting pregnant isn't as easy as they expected. In today's video, we'll talk about why that might be happening and the medical options that can help. Stick around until the end, because we'll also cover when to see a doctor and what treatments are available. Getting pregnant depends on several things working together: healthy eggs, sperm, fallopian tubes, hormones, and timing. But if even one part of that process doesn't work properly, pregnancy can be harder to achieve. When the issue is with the person who's trying to get pregnant, doctors call it female infertility, or sometimes female factor infertility. Let's go through some common reasons why this can happen. First, let's talk about ovulation. That's when an egg is released from your ovary. It usually happens once a month and is controlled by your hormones. If a sperm meets that egg in the fallopian tube, pregnancy can happen. Your chances of getting pregnant are highest if you have sex 1 to 2 days before ovulation or on the day of ovulation. But here's the challenge: some people don't ovulate regularly or at all. And if ovulation doesn't happen, pregnancy can't happen either. Conditions like polycystic ovary syndrome, thyroid problems, or stress can all affect ovulation. Have you ever tried tracking your ovulation days before? Let me know in the comments. It's more common than you think to get the timing wrong. Another reason can be issues with the uterus or fallopian tubes. If there's scar tissue from a past infection or surgery, the tubes might be blocked. That means sperm can't reach the egg. Sometimes fibroids or scar tissue inside the uterus can also make it difficult for a fertilized egg to implant and grow. Another condition that can make pregnancy harder is endometriosis, when tissue similar to the lining of the uterus grows outside it. This can cause pelvic pain and inflammation, and sometimes damage the fallopian tubes or ovaries. Endometriosis doesn't always prevent pregnancy, but it can make it more difficult. And of course, age plays a big role. As people reach their mid to late 30s, the number and quality of eggs naturally decline. This makes it harder to get pregnant and increases the risk of miscarriage. Did you know that fertility starts to drop more sharply after age 35? It's something many people aren't aware of until they start trying. So, when should you talk to a doctor? If you've been having unprotected sex for a year and haven't gotten pregnant, it's time to check in. But if you're over 35 or your periods aren't regular, don't wait that long. Talk to your doctor after 6 months of trying. You don't have to wait until you've tried for a full year if you're worried. You can always speak to your healthcare provider sooner. So, what can you do yourself? There are simple lifestyle changes that can make a real difference. If you're overweight, losing even a little weight can help your hormones balance and improve ovulation. Avoid smoking and alcohol, which can affect fertility. Track your menstrual cycle to better understand when you're most fertile. Sometimes, small changes can set the stage for a big result. If you've tried for a while and still haven't gotten pregnant, don't lose hope. There are medical treatments that can help depending on the cause. Let's go through some of the main ones. A medicine called Clomiphene. This is often the first treatment doctors try. If you do not ovulate regularly or at all, this medicine improves the chances that you will ovulate. Your doctor will tell you exactly when to take it and when to have sex to get the best chance of success. If Clomiphene doesn't work, your doctor may recommend hormone shots. These shots stimulate your ovaries to release eggs, increasing your chances of conception. Intrauterine insemination. For this treatment, a doctor uses a tube to place sperm directly inside your uterus. This is done right before ovulation. This gives sperm a shortcut to reach the egg. Sometimes it's combined with Clomiphene or hormone shots to improve the odds. In-vitro fertilization. This is a procedure that is usually done if other treatments have not worked. This is one of the most advanced fertility treatments there is. It involves the following. First, you will get hormone shots for a few weeks in order to get your ovaries ready to ovulate. Then just before ovulation, a thin needle is used to remove some eggs from your ovaries through vagina. The eggs are then put into a laboratory dish with sperms, so the sperms can fertilize 1 or more eggs. After 2 to 5 days, the fertilized egg or eggs are put into your uterus. Hopefully, one of them implants and grows into a healthy pregnancy. IVF may be recommended if fallopian tubes are missing or blocked. If tests show that your partner has too few sperms, and if you have not gotten pregnant using other treatments. It's important to remember, fertility treatments don't always work on the first try. What works for one person may not work for another. Choosing a fertility treatment can be emotional and sometimes overwhelming. Things to consider include how well your doctor thinks that the treatment will work. The cost of the treatment. Some treatments cost a lot of money, and insurance might not cover fertility care. The time and side effects involved. You should also talk with your doctor about other options for having children, such as adoption. These decisions can be difficult. You might find it helpful to talk to a counselor or go to a support group for people who are having trouble getting pregnant. If you found this video helpful, please like, subscribe, and share it with someone who might need to hear this. And stay tuned for our next video.